Bonjour. How's it going? I want to talk about two things today. First off, the first ministers are meeting, and they're asking for an increase in healthcare transfers. We absolutely support the call for increasing healthcare transfers. It's clear that decades of cuts at the federal government level from both liberal and conservative governments have starved our healthcare system, made it more difficult for our loved ones to get the care they need, and all of that has been exposed by the pandemic. It's been there from before, but it's just been more exposed as a result of the shortcomings that we're facing in the pandemic. So we absolutely support the increase. And secondly, I really want to focus in on the fact that we're learning more and more from reports that are coming out that some of the biggest companies in Canada received public money, they laid off workers, and they made massive profits. The Prime Minister has no concern about this, has not raised any concerns about this. But the Prime Minister is going after self-employed workers who applied for CERB in good faith, and they're now facing clawbacks. So that is absolutely wrong. They should not be facing those clawbacks. They applied in good faith. The government made a mistake, not those workers. They applied in good faith, and it's wrong that they're facing clawbacks. So these are two really important things that I wanted to talk about today. Donc, comme j'ai souvent dit qu'on est tellement d'accord avec l'idée d'augmenter les transferts de santé aux provinces, c'est essentiel parce que on a vu des décennies de coupures des gouvernements libéraux et conservateurs, et l'impact de ça, c'était le fait qu'on ait moins d'accès aux services de santé pour nos proches. C'est directement le résultat des coupures du gouvernement fédéral. Donc, il faut arrêter ça. Donc, on appuie les demandes des premiers ministres comme Premier ministre Legault qui demandent une augmentation des transferts de santé aux provinces. On appuie cette demande. C'est important de faire ça. Deuxièmement, particulièrement avec la pandémie, ça a montré les lacunes dans notre système de santé créées par le réduit des transferts de santé aux provinces. Et deuxièmement, je vais parler du fait que le gouvernement libéral a donné d'argent aux grandes entreprises. Ces grandes entreprises ont renvoyé leurs employés, leurs travailleurs, et puis ils ont gagné des profits massifs. Et le Premier ministre n'a aucun problème avec ça, mais le Premier ministre veut pénaliser les travailleurs autonomes qui ont fait aucune erreur. Ils ont appliqué pour la PCU de bonne foi. Et maintenant, le Premier ministre veut les pénaliser. Ils ont reçu des lettres qui disent qu'ils vont rembourser un grand montant d'argent avant le 31 décembre. Donc, c'est complètement un problème de faire ça. C'est quelque chose que le gouvernement ne doit pas faire. Et on exige le Premier ministre de tout de suite arrêter cette pénalisation des travailleurs autonomes. Donc, je suis prêt pour vos questions. I'm ready for any questions you might have.
Nous allons prendre les questions. Commençons par les questions au téléphone. Une question suivie par journaliste. We'll now take questions, starting with questions on the phone. One question, one follow-up per reporter. Nous avons approximativement 10 minutes. We'll have approximately 10 minutes. Operator, do we have a first question?
Thank you. Merci. We have a question from Steve Schreier from Reuters. Please go ahead. Your line is now open. Votre ligne est ouverte.
Hello. I was just wondering, earlier the government has tabled legislation to allow temporary new rules to govern a potential election during the pandemic, and I was wondering what you thought of that legislation and whether the NDP would support that.
We still have to take a closer look at the legislation to review it, so we'll give you a more fulsome response once we reviewed it. A couple of things that we've noted as problems with recent decisions around elections is that the reduction in access for people that live in apartment buildings and students in universities, though universities are now mostly online classes, still it's a central hub for students that live close to the university they attend. They live in the community surrounding the university. So the university as a hub is an important way to allow students to vote. So that's something I'm concerned about. We're also concerned about the fact that the voting centers that were in apartment buildings have been discouraged with the current climate. And I absolutely support all public health measures, but we have to balance the importance of participation and make sure that there's solutions in place that will not create barriers for those who are already historically disproportionately represented in politics. So they need to have some solutions so that there can be voting can happen.
Okay, thanks. Can you say that you support in principle the idea of making it safer to vote if there's a pandemic in course when Canadians are called on to do so?
Oh, absolutely. There needs to be people need to be safe when they vote. They need to know that the safe protocols are in place, and that we're following the public health guidelines around what those safety protocols are. I just want to also acknowledge that while we are absolutely committed to following the public health guidelines and safety of Canadians when they vote, we still need to be aware of not creating barriers to voting. And we've seen the worst case of that in the States, where year after year, the policies have made it harder and harder for people to vote. And it's come to the result that the most vulnerable or marginalized people in society are the ones that are facing the biggest barriers to voting. And so I want to raise that as a red flag, that there should be a consideration placed on making sure people can vote and the access is still there.
And next question will be in the room.
Thank you.
Yeah, hi, sir. You mentioned off the top that you think the government or the Liberals should respond to the Premier's request for more healthcare transfers. The Premiers have also insisted that money come without strings attached. Do you think the federal government should offer it that way, or should they be clear that the money has to go into long-term care, mental health, or specific healthcare outcomes?
A couple of things. One is we've got the Canada Health Act that governs for healthcare transfers, the broad principles, which are very fundamental. Some of the highlights being that it's publicly delivered healthcare, that it's accessible, that this care is transferable, it's universal. These are some basic principles that we should absolutely maintain and have already been agreed upon. When it comes to making sure that healthcare goes to people in need, and the question around long-term care is something that's very top of mind for a lot of Canadians, for me as well. I'm worried about seniors and some of the horrible things that we've heard about the way they're being treated in long-term care homes. In order for the federal government to have a role in helping to establish consensus, standards, and strings attached to funding, the federal government has to play a better role in funding. If the federal government's not funding at a significant level, then it is very difficult for the federal government to then play a role in determining where the money goes. So I think the Canada Health Act provides some good guidelines, firstly. And secondly, if the federal government steps up instead of the opposite, which we've seen as an erosion of federal government support, steps up and starts paying its fair share and contributing its fair share, then there's a greater role in making sure the money goes to the people who need it most. But Canadians would agree that it should go to those who need it.
And today's the 2-year anniversary of the arbitrary arrest of Michael Spavor and Michael Kovrig. I'm wondering where you think the Liberals have failed on this file. What would your potential government have done differently to bring these two men home?
Well, first of all, 2 years, these are Canadians. These are our Canadians that are in horrible conditions, detained in very difficult conditions. Their families are still wondering what's going to happen. I can't imagine what it's like for the families, and for Mr. Spavor and Mr. Kovrig, what they're going through is very terrible. And all Canadians believe that we need to return these Canadians safe and sound back home. So that's our first thought, given it's 2 years. I would not in any way suggest that this is a simple file. This is a very complicated file. What we need to do is everything possible to get those Canadians back home. And this is a file that I know there's a lot of different issues that we're dealing with, but we've got to focus in on getting those Canadians back safe and sound.
Next question will be on the phone. Operator, next question.
Thank you. Merci. The next question is from Mike Blanchfield from Canadian Press. Please go ahead. Votre ligne est ouverte.
Yeah, hi, Mr. Singh. Thanks
Hi there.
for the time and following up. Yeah, hi, and following up on the question just a moment ago. Do you think that the government has got any sort of leeway or any ability to persuade the Biden administration to maybe rethink the prosecution in this May and see if that can lead to a resolution that might bring the two Michaels home?
I think we should keep all options open and using our relationship with international partners, diplomacy, working with the United States on this. I think everything has to be available. All tools need to be available to secure the safe release of the two Canadians, Mr. Spavor and Mr. Kovrig. Absolutely.
Follow-up?
Did you have a follow-up?
No, I'm good. Thanks.
Next question in the room, David.
Thanks.
Hey, Mr. Singh. Good
Hey.
afternoon. David Burton here. Good to see you too. What concerns do you have about the federal government's plans to distribute vaccines? Now that we know that distribution will begin at least on the first couple of doses on Monday, if I'm not mistaken, they arrive in Canada, and that we should see most Canadians starting to get the vaccination by, I believe it's summer, spring, by the end of 2021. We're still kind of not sure on that. What concerns do you still have, or is everything hunky-dory?
Well, I think it's very, very encouraging that we've got a vaccine, that it's been approved. I trust the Canada Health regulations in terms of getting that approval. So that's positive. That's something that gives Canadians a lot of hope. The major concern with the Liberal government on the vaccine has been the lack of transparency around a plan. And I don't see any explanation why other countries have provided a very thorough plan, laid it out in advance, why the Canadian government, why Prime Minister Trudeau hasn't done the same. That's one serious concern, and it's been a major drawback that the Liberal government hasn't provided that clear plan, transparent plan, so all Canadians know. That's one. The second concern that I would raise is that while the Pfizer vaccine is now approved, that will mean that major cities in Canada will have access, but not all the vulnerable people in Canada. So even in a major city, long-term care residents, it would be very difficult for an elderly, a senior that is facing health issues, compromised immune system, to be transported from their long-term care home into a hospital to get the vaccine. So there's concerns about getting the vaccine to some of the people who need it most. That's one concern. And then in general, we need to continue to look for other solutions. The Moderna vaccine, for example, seems more promising in that it can get out to other communities. And I'm thinking about Indigenous communities who are right now fighting for their lives in outbreaks in the north, in northern Manitoba, in Nunavut. To get those communities access to vaccines, the Pfizer vaccine simply won't be good enough. So there's some positive news here, but my big concern is the lack of a clear plan and a way to get the vaccine to communities outside of major cities.
From what we're hearing from the Liberals, it's that, the plan around distributing these vaccines and acquiring these vaccines is changing by the minute, by the day. Isn't that a I guess what I'm trying to ask here is that an acceptable response to this thing, that that this is a complicated distribution. It's hard to. This is very complicated. So they can't really give us all the answers because they just don't have all the answers. Is that acceptable?
Well, there's a certain degree of uncertainty. I think that's fair to say. But other countries have provided really thorough plans, and they're going through the exact same things that we're going through. Australia, I give as an example, is a very similar size country, and they released a plan well in advance, months ago, and you could search it online. You could look at their plan, pretty thorough, 12 pages, goes through exactly what they're going to do with various contingencies. If one vaccine is successful, what their plan is. If another one is successful, what their plan is, and production of the vaccine in their own country. So they've got a thorough plan. America's got over 70 pages of a plan. The UK has a plan. So I don't think it's an excuse not to have a plan. There might be some things missing in the sense that there's some uncertainties, but to have a transparent sense of what's to be expected, some rough timelines, a guideline of what's going to happen in the rollout, letting us know that they had contacted the military. A lot of questions that we have now would have been satisfied if they would just been more transparent. If they had a plan, let us know what it was. But it doesn't seem like they had a plan, and they're kind of scrambling, and that's problematic.
Check once more if we have a question on the phone, operator.
Thank you. Merci. We have a question from Cormac Masweeney from City News. Please go ahead. Your line is now open. Votre ligne est ouverte.
Thanks. Just on the situation with Michael Kovrig and Michael Spavor, I know you said all options should be on the table, and I'm just wondering, do you support, as an option, Magnitsky-style sanctions on Chinese figures in order to try and send a message to the government there to release the two Michaels? And do you think, when it comes to the response so far from the Trudeau government, do you think it's time to take a tougher stance?
I preface my earlier remarks with the fact that I'm not one that's going to in any way assume that this is a simple matter. It is very complicated. We know that the relationships we have with countries around the world are vital for jobs in Canada. At the same time, we've got to be very focused on getting those Canadians returned. And so I think we need to be open to exploring options. And you've outlined one potential option around the potential use of economic targeted sanctions. Effectively is what those Magnitsky tools would provide. We need to be just focused on what is the best way to return Canadians and be focused on that. And this is one where I don't think any partisan posturing is useful. I really believe we've just got to be focused on using every tool with the goal that it is the most effective way to get those Canadians back.
As a follow-up on another topic, the UK government is expressing concern because the basic holdover agreement, if you will, on trade that they have both countries have signed, but needs to be ratified by Parliament, hasn't been passed by Parliament yet, and was only recently introduced in Parliament. So the clock is ticking before the end of the legislative sitting, and there are concerns that there could be tariffs imposed on Canadian and UK goods as a result of this possibly not being passed by Jan 1. Have there been any discussions at all between the parties about the possibility of unanimously pushing this through before the House rises? What's your party's position on that?
Not so far. There's not been those type of discussions. My position on trade agreements is that we've seen in the past trade agreements that have benefited large companies, multinational companies, but have not benefited workers. And my focus is I don't want us to rush into an agreement that's not going to protect workers. It has to be an agreement that gives our workers in Canada a level playing field to compete with workers around the world. In this case, it's with the UK. And I think that's got to be the focus. Workers have to be put first. And then in addition, other concerns around environmental protections, concerns around making sure we're setting ourselves up for success with a fair trade agreement as opposed to just purely looking at it through a lens of a free trade agreement. It's got to be fair, and it's got to be fair for workers.
And last question will be in the room. Jordan?
Good afternoon, Mr. Singh.
Good afternoon.
Jordan Press with CP. I want to ask you just about, just going back to the premiers and meeting with the Prime Minister today, specifically when it comes to long-term care, and I know you've talked about this before as far as potential for, to improve those standards. When it comes to setting national standards for them, would you like to see would you like to see long-term care almost brought under the Canada Health Act in the same kind of way that, so basically there are national standards tied to federal funding that the provinces have to follow, otherwise there's no money that flows to them?
I think that there is a really solid argument around bringing long-term care either into the Canada Health Act or a standalone long-term care act, Long-Term Care Health Act. Either one, I'm not particular about the solution, but the principle would be that there are a set of principles that all provinces and territories agree that are fundamental in a universal publicly delivered healthcare system, that we agree on these principles and then we move forward. One of the biggest concerns that has been raised about long-term care in particular is the for-profit model being where we've seen the worst conditions of seniors. And it is very clear that profit should not have a place in the care of our seniors. That's something I think is abundantly clear. And secondly, with national standards, those should just be basically the best practices. Let's ask the best practices from provinces and territories, find out what worked and what didn't work, and establish some guidelines around these are the things that we've learned from this really difficult time where we've seen some horrible examples of seniors in deplorable conditions. What can we learn from that? I think it would be remiss if we didn't actually put those learnings together and establish some best practices.
No follow-up? This concludes the press conference.
Thank you very much, Merci.